हेलो एवरीवन। सो आज का टॉपिक है हम लोग का हाइपोपिट्यूटरिज्म। सो हाइपोपिट्यूटरिज्म, हाइपो मीन्स deficiency, pituitarism means it is some kind of a disease related to pituitarism. So pituitarism means pituitary gland is also known as the master gland. So it has two parts, that is the anterior pituitary and the posterior pituitary. Anterior pituitary is also known as the adenohypophysis and the posterior pituitary is also known as the neurohypophysis. Okay, so whenever we say hypopituitarism means there will be some kind of a deficiency, like hypo and pituitarism means deficiency of one and more hormone. So what may be the causes of this? So it may be related to the hypothalamus or it may be related to the pituitary gland, because hypothalamus is the one who will stimulate the pituitary to release some kind of a stimulating hormone. Okay, so the cause is related to hypothalamus and pituitary. Let's talk about the causes of pituitary. So pituitary tumor is one of the causes that leads to the hypopituitarism, in which what will be the cause, and it will lead to the deficiency of one hormone. And if there is a decrease in one hormone, that doesn't mean that it will only decrease other hormones, it may increase the other hormones. Like there may be the deficiency of thyroid stimulating hormone and there may be the increase in the growth hormone, like there is a decrease in growth hormone. Like whenever there is an increase in growth hormone, it may lead to acromegaly, and whenever there is increase in growth hormone leads to acromegaly and decrease in growth hormone will lead to dwarfism. Okay, so there are other causes like there may be the secondary metastasis, like there is a tumor in the other place and it will spread to the pituitary and thereby causing the deficiency of the hormone. Now the other causes may be the injury to the pituitary, any kind of a traumatic brain injury, inflammations due to bacteria, virus, protozoa, infiltrate disease like hemochromatosis, sclerodermosis, like this. So these are the infiltrate diseases. So hemochromatosis is basically the iron toxicity which will basically infect or infiltrate disease of pituitary. So there are many other causes which will also affect the pituitarism, like sometimes pituitary is incapable to produce certain kind of hormones, like which is known as the pituitary apoplexy, which is the incapacity of the pituitary to produce the hormone. Why there is an incapacity? Because there may be the ischemic infarction or any kind of hemorrhages, like whenever there is an increase in the cerebrovascular intracranial pressure, what will happen, like there may be the rupture of the blood vessels which may lead to the hemorrhage, there may be the formation of thrombosis, like there may be the secondary causes. Okay, so there are lots of secondary causes which may lead to the hypopituitarism. So it is, you have to make very clear that there is that whenever there is a hypopituitarism, it was not related to the one kind of a causes, there may be the different causes which may contribute to the hypopituitarism. Okay, so another cause I have already told you, that is the pituitary apoplexy. Now the another cause is the Sehan syndrome. Sehan syndrome is the one which comes in the exam of AIMS. So you should remember this syndrome, that is the Sehan syndrome, which is the infarction of the hyperplastic. Okay, so it basically occur in the pregnant woman due to the PPH, in which there is an infarction. Okay, infarction will occur in the pituitary and thereby leading to the hypopituitarism. Now another thing is so let's talk about the causes and the clinical manifestation whenever there is a deficiency of hormone. So it basically depends which hormone has been depleted, or what is the hormone, which hormone there is a deficiency. So if there is a deficiency of adrenocorticotropic hormone, so it may lead to the addition disease, where there is a deficiency of corticoids. Thyroid stimulating hormone, there is a deficiency of thyroid, which is the hypothyroidism. Gonadotropin, that is the hypogonadism. Growth hormone, that is the polydipsia and polyuria will cause, that is diabetes insipidus. Okay, the main thing is the pituitary is in the hypophyseal, located in the sella tussica. So it basically affects the brain. Okay, so around the brain it may affect the visual field. Okay, so in visual field what will be there will be the bitemporal hemianopsia. Hemianopsia means half. Okay, anopsia means visual field, and it may also lead to the headache. So these are the symptoms which will be shown. Now the symptoms basically depends where is the problem. Okay, if there is a problem in thyroid, there will be the deficiency of thyroid. If there is a problem in corticoid, then it will lead to a deficiency. So basically it depends on the site where it is affecting and which hormone there is a deficiency. Now coming to the part that is the diagnosis. So diagnosis part, there is the diagnosis is made by the dynamic functioning test. Dynamic functioning test is basically the hormone. There is an investigation of hormone, which hormone has been which hormone has been decreased. So there is a stimulatory agent will be given to the persons, like there is a deficiency. Okay, so when I will stimulate that hormone, there will be the increase in the secretion. Okay, so for that we have to assess the level of hormone before giving stimulatory agent and after giving stimulatory agent. So before giving stimulatory agent, we have to assess the hormone, what is the amount of the hormone. After that we have to give the stimulatory agent, and then if there is an increase in the hormone, means it is due to the hypopituitarism, because there is no stimulating effect. So there is no hormone has been released. So whenever we are giving the stimulatory agent, there will be the increase in the hormone. This is the one of the diagnosis. Now insulin tolerance test. So basically insulin is the one which will decrease the glucose, and the it is basically used to assess the deficiency of growth hormone and the cortisol. Growth hormone and the cortisol are the contradictory. Okay, so contradictory hormone means growth hormone and the cortisol will increases the glucose. So first we have to assess the baseline data, means एक रात पहले ही हम लोग assess कर लेंगे ग्लूकोज का लेवल या फिर ग्रोथ हार्मोन का लेवल. ओके, देन उसके बाद क्या करेंगे, स्टिमुलेटरी एजेंट देंगे, जो कि यहाँ पे है इंसुलिन 0.1 kg मैक्रोग्राम पर kg दिया जाता है IV. Okay, then after that, if there is a decrease in the glucose, means there is the problem with the pituitarism. Okay, so here there will be the decrease in the cortisol and the growth hormone. Okay, and sample will be taken after the analysis. So what will be the finding? So before there will be decrease in the cortisol and the growth hormone. After insulin also there is a decrease in the growth hormone and the cortisol, means there is a hypopituitarism. Okay, so यहाँ पे क्या होना चाहिए था कि अगर पिट्यूटरी अच्छे से काम कर रहा होता तो यहाँ पे हम लोग को पता चल जाता कि अगर इंसुलिन दे रहे हैं तो उसको पता चल जाता कि मुझे कॉर्टिसोल और ग्रोथ हार्मोन को बढ़ाना है. पर यहाँ पे इंसुलिन देने के बावजूद भी अगर घटा हुआ हो कॉर्टिसोल और ग्रोथ हार्मोन, देन इट इज़ श्योरली अ हाइपोपिट्यूटरिज्म. नाउ इट इज़ कॉन्ट्राइंडिकेटेड, दिस टेस्ट इज़ कॉन्ट्राइंडिकेटेड इन केस ऑफ द कार्डियक डिजीज़ एंड एपिलेप्सी. ओके, नाउ after the test you have to give the IV dextrose, because there is the chances like the person may develop the hypoglycemia. Now the another test is the modern combined test. Here also the provocative stimuli will be given, and there is a decrease in the hormones, that means the hypopituitarism. Then radiological test will be done, MRI, CT scan. Now the coming to the part of management, that is there is a pituitary adenoma, so there may be the surgical procedures will be then, that is the hypophycectomy, and there is a decrease in the hormone. Then for that we have to do hormone replacement therapy. For for the deficiency of adenocorticotropic hormone, we should give hydrocortisone, prednisolone. Okay, for thyroid stimulating hormone, if there is a deficiency, then we have to give the levothyroxine. For LH and FSH deficiency, testosterone given IM gel patch 2 times per month. Monitor prostate specific antigens, testosterone. In female we have to do the hormone replacement therapy, means if there is a adenoma, so we will go for the surgery, we will do hypophycectomy. If there is a